The sirens cut through the morning air like a blade through silk, their wailing crescendo drowning out the soft hum of the medical equipment inside the East Side Community Health Clinic. Dr. Marcus Washington looked up from the vaccine vial he was preparing, his dark eyes reflecting the flashing red and blue lights that suddenly bathed the waiting room in an ominous glow. The elderly woman sitting across from him, Mrs. Rodriguez, clutched her purse tighter as three uniformed officers pushed through the clinic's glass doors with the kind of urgency typically reserved for armed robberies or domestic violence calls. "Are you Dr. Washington?" The lead officer's voice carried the weight of authority and something else. Something that made the 23 patients waiting for their COVID-19 vaccines shift uncomfortably in their plastic chairs. Marcus set down the vial with steady hands, though his pulse quickened. "I am..." "Is there a problem, officer? We received a report that someone here is impersonating a medical professional. We're going to need to see some identification." The words hung in the air like smoke from a fire that had just begun to burn. Marcus felt the familiar tightness in his chest, the same sensation he'd experienced countless times during his residency at Johns Hopkins, during his fellowship in infectious diseases, during every moment when his credentials were questioned, not because of his competence, but because of the color of his skin. He reached slowly for his medical bag, where his license and hospital ID were always kept. The East Side Community Health Clinic sat in the heart of one of the city's most diverse neighborhoods, a place where Spanish, mixed with English, mixed with Arabic in the grocery stores, where the smell of empanadas competed with the aroma of shawarma, where families who had fled violence in their homelands came to rebuild their lives. Marcus had chosen this clinic precisely because it served the forgotten, the marginalized, the people who needed healthcare most and could afford it least. Every Tuesday and Thursday morning for the past 8 months, he had driven his black Honda Civic from his apartment in the suburbs to this modest building with its peeling paint and flickering fluorescent lights. The clinic's budget was tight, but its mission was clear: provide quality healthcare to anyone who walked through its doors, regardless of their ability to pay, their immigration status, or their insurance coverage. Marcus had been administering vaccines since 6 that morning, moving with the practiced efficiency of someone who had given thousands of shots during his medical career. Mrs. Chen, a soft-spoken seamstress who worked 16-hour days in a factory across town, had been his first patient. She'd thanked him in broken English and handed him a small bag of homemade dumplings. Then came Roberto, a construction worker whose calloused hands shook slightly as he rolled up his sleeve, admitting it was his first time seeing a doctor in 15 years. The rhythm of the morning had been interrupted when Karen Pemberton arrived at 9:30, her silver BMW pulling into the small parking lot with the confidence of someone accustomed to taking up space. She was a woman in her early 50s, her blonde hair styled in the kind of perfect bob that required weekly maintenance, her designer handbag clutched like a weapon. She had surveyed the waiting room with the expression of someone who had walked into the wrong restaurant and was considering whether to stay or demand to speak to the manager. "I'm here for my vaccine," she had announced to the receptionist, her voice carrying the tone of someone unused to waiting or explaining herself. The receptionist, a young woman named Maria, whose patient smile never seemed to waver despite the daily challenges of working in an underfunded clinic, had handed Karen a clipboard. "Please fill out this form, ma'am. The doctor will see you shortly." Karen's eyes had scanned the room, taking in the faces of the other patients. Her gaze lingered on Mrs. Rodriguez, who was speaking quietly to her grandson in Spanish. It paused on Ahmed, a taxi driver who was reading a book in Arabic while waiting. Finally, it settled on Marcus, who was preparing a vaccine for a teenage girl whose mother held her hand for comfort. "Excuse me," Karen had said, her voice cutting through the gentle murmur of conversation. Is that man actually a doctor? The waiting room had fallen silent, as if someone had pressed a mute button on the television. Marcus had looked up from his work, meeting Karen's stare with the kind of measured calm that came from years of dealing with questions about his qualifications. "I am Dr. Marcus Washington," he had said simply. "I'll be administering your vaccine when it's your turn." Karen's laugh had been sharp, like the sound of breaking glass. "I don't think so. I want to see a real doctor." The words had hit Marcus like a physical blow, but he maintained his composure. "I have my medical degree from Johns Hopkins and completed my residency at Massachusetts General Hospital. I'm board certified in internal medicine and infectious diseases." "Anyone can say that," Karen had replied, her voice growing louder. "I want to see credentials. I want to see proof. I'm not letting some—" She had paused, her next words hanging in the air like a loaded gun. "I'm not letting some unqualified person inject me with anything." Marcus had shown her his medical license, his hospital identification, his board certifications. He had done so with the weary patience of someone who had performed this ritual too many times before. But Karen had examined each document with the suspicious intensity of a forensic investigator, photographing them with her phone, shaking her head as if she had discovered some elaborate fraud. "These could be fake," she had declared finally. "I'm calling the police." And now, 20 minutes later, the police were here, their presence transforming the clinic from a place of healing into something that felt more like a crime scene. The patients who had been waiting patiently for their vaccines now watched with growing anxiety as Marcus was asked to step away from his medical station. "Officer, I can show you my credentials," Marcus said, his voice steady despite the humiliation burning in his chest. "I can also have the hospital confirm my employment." The lead officer, a middle-aged man whose nameplate read Johnson, examined Marcus's medical license with the same skeptical attention that Karen had given it. "Ma'am," he said, turning to Karen, "what exactly made you think this man wasn't a doctor?" Karen's answer came without hesitation, her voice carrying the conviction of someone who believed her own prejudices were simply common sense. "He doesn't look like a doctor. He's too young, and he's—" She gestured vaguely at Marcus, as if his very presence was evidence of some crime. "I mean, look at this place. Look at the people here. Would a real doctor work in a place like this?" The insult landed with the force of a slap, not just on Marcus, but on every patient in the waiting room. Mrs. Rodriguez's grandson, a high school student who had been translating for his grandmother, stood up slowly. "Doctor, Washington saved my abuela's life last year," he said, his voice shaking with anger. "He diagnosed her diabetes when the emergency room sent her home with antacids." "That's right," added Roberto, his work boots echoing against the linoleum floor as he approached the group. "This man, he don't judge nobody. He treat my daughter's asthma. He don't ask for no money when I can't pay." But Karen was unmoved by the testimonials. "I don't care what you people think. I want a real doctor, and I want him investigated. Something's not right here." Officer Johnson looked uncomfortable, caught between a complaint that seemed increasingly baseless and a situation that was rapidly spiraling out of control. "Dr. Washington, I'm going to need you to come with us while we sort this out." "Am I under arrest?" Marcus asked, his medical training kicking in as he methodically secured the vaccine vials and disposed of the used needles. "No, sir. But we need to verify your credentials." The irony was not lost on Marcus. He had spent 4 years in medical school, 3 years in residency, and 2 years in fellowship training. He had passed every board exam, completed every certification, published research papers on vaccine hesitancy in underserved communities. Yet, here he was, being led away from his patients because a white woman found his presence inconvenient. As the officers escorted Marcus toward the door, the impact of their intervention became immediately apparent. The remaining patients looked at each other with uncertainty and fear. Some began to gather their belongings, unsure whether they should stay or leave. Others pulled out their phones, recording the scene with the instinctive knowledge that this moment needed to be documented. Maria, the receptionist, tried to maintain order. "Please, everyone, stay calm. We're going to reschedule your appointments as soon as possible." But calm was the last thing anyone felt. Mrs. Chen, who had been waiting for 2 hours for her second vaccine dose, began to cry quietly. She had taken time off work, lost a day's pay, and arranged for her neighbor to watch her children. Ahmed, the taxi driver, shook his head in disgust. "This is America," he muttered to himself. "This is supposed to be America." Karen watched the scene with what appeared to be satisfaction. "You'll thank me later," she told the room. "I'm protecting all of you from a fraud." Outside, as Marcus was placed in the back of the police car, he caught sight of the clinic's mission statement painted on the window: "Health care for all, dignity for everyone." The words seemed to mock him now, a promise that felt as fragile as the trust that had been shattered in the waiting room. The drive to the police station was silent, except for the radio chatter and the sound of Marcus's own breathing. He thought about the patients he was supposed to see that day, the vulnerable people who depended on the clinic for their health care. He thought about Mrs. Rodriguez, whose diabetes medication needed adjustment, and about the teenage girl who had been waiting for her first vaccine dose. At the station, the verification process was humiliating in its thoroughness. Marcus watched as officers called Johns Hopkins, Massachusetts General, and the State Medical Board. Each call confirmed what his credentials had already proven: he was exactly who he claimed to be. Dr. Marcus Washington, M.D., board certified in internal medicine and infectious diseases, currently employed at Metropolitan General Hospital, with privileges at the East Side Community Health Clinic. "I'm sorry for the inconvenience, Doctor," Officer Johnson said finally, his embarrassment evident. "You're free to go." But the damage was done. By the time Marcus returned to the clinic, word had spread through the neighborhood like wildfire. The waiting room was empty, except for Maria, who looked up from her desk with eyes red from crying. "They all left," she said simply. "Mrs. Rodriguez said she'll try to come back next week. Ahmed said he's going to find another clinic. Mrs. Chen just cried and left." Marcus sat down heavily in one of the plastic chairs, feeling the weight of every patient who had been denied care because of Karen's accusations. The vaccines that should have been administered sat unused in their refrigerated storage, a stark reminder of the health crisis that his absence had created. "Doctor, there's something else," Maria said quietly. "That woman, Karen, she called the hospital. She called the medical board. She's demanding an investigation." Marcus closed his eyes, knowing that Karen's campaign was far from over. In his experience, people like her didn't simply give up when their initial complaints were dismissed. They escalated, they persisted, they found new ways to challenge his right to practice medicine. The next morning brought the first sign that Karen's efforts were gaining traction. Dr. Elizabeth Harper, the chief of staff at Metropolitan General Hospital, called Marcus into her office. She was a woman in her 60s, with silver hair and the kind of no-nonsense demeanor that had helped her climb the ranks in a male-dominated profession. "Marcus, we need to talk about what happened yesterday," she said, gesturing for him to sit across from her mahogany desk. "I've received several phone calls about your conduct at the clinic." "My conduct?" Marcus couldn't hide his surprise. "Dr. Harper, I was administering vaccines to underserved patients. The only issue was a woman who refused to believe I was qualified to practice medicine. I understand that, Marcus. But the complaint suggests there may have been some irregularities in your documentation. The word hung between them like a poisonous cloud. Marcus felt the familiar tightness in his chest, the sense that no matter how many credentials he earned, how many lives he saved, how many patients he helped, there would always be someone ready to question his legitimacy. What kind of irregularities? He asked, his voice carefully controlled. The complainant suggests that your medical license may have been altered, that your hospital identification was suspicious. She's demanding a full investigation. Marcus stared at Dr. Harper, trying to process the accusation. You want to investigate whether my medical license is real, whether my hospital ID is legitimate, Dr. Harper. You've worked with me for 3 years. You've seen my work, my patient outcomes, my research. I know, Marcus. But the board is taking this seriously. They want to review your credentials, your patient files, your work at the clinic. So, I'm suspended. Pending investigation. I'm sorry, Marcus. My hands are tied. Marcus left the hospital that day, feeling like he was walking through a nightmare. His medical bag felt heavier than usual, weighted down by the knowledge that his ability to practice medicine had been stripped away by the complaints of a woman who had never met him before yesterday. The suspension meant that the Eastside Community Health Clinic would have to cancel its vaccine program indefinitely. The patients who depended on the clinic for their health care would have to find alternatives, assuming they could afford them and had the transportation to reach them. Karen, meanwhile, had not been idle. She had contacted local news stations, posted on social media, and reached out to community groups. Her message was consistent. A dangerous fraud had been operating in the neighborhood, and she had heroically exposed him before he could harm anyone. I probably saved lives yesterday, she told WKTV News during a phone interview. Who knows what this man was actually injecting people with? Who knows if he was even qualified to handle medical equipment? The story spread through certain circles with the speed of a virus, amplified by people who were eager to believe that their suspicions about affirmative action and diversity hiring had been vindicated. Marcus found himself the subject of online harassment, with strangers questioning his qualifications and demanding that he be prosecuted for fraud. But Karen had underestimated the community that Marcus served. The patients who had been turned away from the clinic didn't simply disappear. They talked to their neighbors, their family members, their friends. They shared their stories about the young doctor who had treated them with dignity and respect, who had listened to their concerns and addressed their health problems without judgment. Mrs. Rodriguez's grandson, the high school student who had defended Marcus in the clinic, created a social media account dedicated to sharing testimonials about the doctor's work. Dr. Washington diagnosed my grandmother's diabetes when 3 other doctors missed it, he wrote. He saved her life, and he's never asked for anything in return. The stories began to accumulate like drops of water that eventually form a river. Roberto shared how Marcus had stayed late to treat his daughter's asthma attack, refusing payment because he knew the family couldn't afford it. Ahmed described how the doctor had helped him navigate the healthcare system when his wife was diagnosed with breast cancer. Dr. Sarah Chen, a colleague of Marcus's at Metropolitan General, was one of the first to speak out publicly. I've worked alongside Dr. Washington for 3 years, she told a local reporter. He's one of the most skilled and compassionate physicians I've ever known. The suggestion that he's not qualified to practice medicine is not just wrong. It's dangerous. The story began to shift as more details emerged. Investigative journalists discovered that Karen had a history of complaints against healthcare providers, particularly those who served minority communities. She had previously filed complaints against a Latino pediatrician, an Indian cardiologist, and a Middle Eastern surgeon. all of whom had been cleared of any wrongdoing. The revelation came during a hastily arranged press conference outside Metropolitan General Hospital. Dr. Harper stood at a podium surrounded by microphones, her face grim as she addressed the growing crowd of reporters and community members. After a thorough investigation, we have concluded that Dr. Marcus Washington is fully qualified to practice medicine, she announced. His credentials are legitimate, his work is exemplary, and his suspension is hereby lifted. But the vindication felt hollow to Marcus as he watched from the crowd. The damage had been done. His reputation had been questioned. His patients had been denied care, and his faith in the system had been shaken. He thought about the Hippocratic oath he had taken when he graduated from medical school. First, do no harm. Karen's actions had caused more harm than any medical error he could have made. "Dr. Washington," called out a reporter from the crowd, "how do you respond to the accusations that were made against you?" Marcus stepped forward, his voice steady despite the emotion churning beneath the surface. "I respond by getting back to work. There are patients who need care, and that's what I'm trained to do." "What about the woman who made the complaint? I hope she finds the peace she's looking for," Marcus replied, "and I hope she understands that healthcare is a human right, not a privilege based on someone's appearance or background." The crowd began to applaud, but Marcus raised his hand for silence. "I want to thank the patients who stood up for me, who shared their stories, who refused to let lies define who I am. That's what real community looks like." As the press conference ended, Marcus felt a hand on his shoulder. He turned to see Mrs. Rodriguez, who had somehow made her way through the crowd. She was carrying a small bouquet of flowers and a card signed by dozens of patients. "Mijo," she said, using the affectionate Spanish term for son. "You are our doctor. You are family." The next day, Marcus returned to the Eastside Community Health Clinic to find a line of patients waiting outside. Some were people he had treated before. Others were new faces drawn by the stories they had heard. Maria greeted him with a smile that seemed brighter than the fluorescent lights. "Dr. Washington," she said, "welcome back. We have a lot of work to do." As Marcus began seeing patients again, he noticed something different. The community that had always been supportive had become even more protective. Patients would greet him with extra warmth. Volunteers would offer to help with administrative tasks, and other healthcare providers would stop by to show their support. The final chapter of Karen's campaign came 3 weeks later, when the City Council convened a special session to address the incident. The council chamber was packed with community members, healthcare providers, and activists. Karen sat in the front row, her expression defiant despite the weight of evidence against her. Councilmember Janet Williams, a longtime advocate for healthcare access, read from a prepared statement. "The actions taken against Dr. Washington represent not just an attack on one individual, but an attack on the entire community's access to healthcare. We cannot allow prejudice to masquerade as concern for public safety." The council voted unanimously to commend Dr. Washington for his service to the community and to implement new protections for healthcare providers working in underserved areas. They also announced that Karen would be banned from all city-funded healthcare facilities, pending a formal investigation into her pattern of complaints. As the meeting concluded, Marcus stood to address the crowd. "I want to thank everyone who stood up for truth, who refused to let fear and prejudice dictate how we treat each other. Healthcare is about healing, not just physical ailments, but the wounds in our community." I also want to say something to those who might share Karen's doubts about doctors who don't look like what they expect. We come in all colors, all backgrounds, all ages. What matters is our training, our compassion, and our commitment to helping people heal. The applause was thunderous, but Marcus continued. This experience has taught me that healing happens not just in exam rooms and operating theaters, but in moments like this, when a community comes together to defend what's right. 6 months later, the East Side Community Health Clinic had expanded its services and hired 2 additional doctors. The vaccine program that had been interrupted by Karen's complaints was now serving twice as many patients. Marcus had been promoted to medical director, and the clinic had received a grant to provide mental health services to the community. On a warm Tuesday morning, as Marcus prepared vaccines for the day's patients, he reflected on how the crisis had ultimately strengthened the community. Mrs. Rodriguez's diabetes was well controlled. Roberto's daughter's asthma was managed with proper medication, and Ahmed's wife was in remission from her cancer. The clinic had become more than a place where people received medical care. It had become a symbol of resilience, of the power of community to overcome prejudice and protect the vulnerable. The mission statement painted on the window seemed more true than ever: healthcare for all, dignity for everyone. As his first patient of the day, a young mother with her infant son settled into the chair across from his desk. Marcus felt the familiar satisfaction of beginning another day of healing. The sirens that had interrupted his work months ago were just a memory now, replaced by the sounds of a community that had learned to stand together. "Good morning, Dr. Washington," the young mother said, her voice carrying the trust that had been restored through struggle and solidarity. "Good morning," Marcus replied, reaching for the vaccine that would protect her child from disease. "Let's get started." Outside, the neighborhood continued its daily rhythm. Children walked to school, vendors sold fresh fruit from their carts, and neighbors greeted each other in the mixture of languages that made this community unique. The East Side Community Health Clinic sat at the center of it all, its doors open to anyone who needed care, its mission unchanged by the attempts to undermine it. In the end, Karen's actions had accomplished something she never intended. They had created a stronger, more united community. The patients who had been turned away that day had become advocates for healthcare access. The doctors who had been questioned had become more committed to serving underserved populations. The community that had been attacked had become more protective of its most vulnerable members. Marcus kept a copy of the thank you card from his patients in his medical bag, a reminder of the healing power of community solidarity. Every time he opened it, he was reminded that medicine was about more than treating symptoms and prescribing medication. It was about affirming the dignity of every person who walked through the clinic doors, regardless of their background, their appearance, or their ability to pay. The story of what had happened at the East Side Community Health Clinic spread beyond the neighborhood, becoming a case study in medical schools and a rallying cry for healthcare justice advocates. But for Marcus, the real victory was much simpler. It was the trust in his patients' eyes, the knowledge that he could continue his work without fear, and the understanding that his community would always have his back. As the sun set over the city, casting long shadows across the clinic's parking lot, Marcus locked the doors and headed home. Tomorrow would bring new patients, new challenges, and new opportunities to heal. But tonight, he felt the deep satisfaction of knowing that he had fought for his right to practice medicine and won, not just for himself, but for every healthcare provider who had ever been judged by their appearance rather than their qualifications. The last entry in the clinic's logbook that day read simply, 37 patients served, 37 lives touched, community stronger than ever. It was a fitting end to a chapter that had begun with sirens and accusations, but had concluded with healing and hope. In the months that followed, Karen's name became synonymous with the kind of prejudice that the community had overcome. She had left the neighborhood, unable to face the consequences of her actions, but her legacy remained as a cautionary tale about the dangers of letting fear and bigotry interfere with healthcare. Marcus, meanwhile, had become more than just a doctor to his patients. He had become a symbol of perseverance, a reminder that dignity and respect could triumph over discrimination and doubt. Every vaccine he administered, every patient he treated, every life he saved was a testament to the power of truth over lies, of community over division, of healing over harm. The East Side Community Health Clinic continued to serve its diverse population, its doors open to all who needed care. The mission statement on its window had been repainted in multiple languages, a visible reminder that healthcare truly was for everyone, and that dignity was not a privilege to be earned, but a right to be protected. And in the end, that was perhaps the most important lesson of all, that when a community stands together, when truth is defended against lies, when dignity is protected against discrimination, healing becomes possible not just for individuals, but for entire communities. The sirens that had once threatened to tear the community apart had instead become the catalyst for making it stronger, more united, and more committed to the principle that healthcare, like justice, should be colorblind.